Hello everyone, welcome back to my YouTube channel Midcode Education. So now I am going to discuss about the ICD introduction. Okay, this is our first medical coding session, class-wise first medical coding session. Okay, so let us start with ICD introduction. Before that, a basic thing related medical coding. What is medical coding? I'm also including. Okay. I have already uploaded CPT, all about CPT in my yesterday's live, and now I am going to discuss ICD, our first textbook. Okay, ICD. What is the meaning of ICD? It is an international classification of diseases. Okay, and let's start. What is medical coding? Okay, medical coding means the process of converting diseases, treatments, medical supplies, and implants used for the treatment from a medical report into universal accepted alphanumeric code format is known as medical coding. Okay, so this is the basic process of coding. Okay, it convert diseases, treatments, medical supplies, medical procedures, medical equipments, etc., into acceptable, universally acceptable alphanumeric codes. So this type of format is known as medical coding. Clear? And purpose of coding. There are four or more purpose are there, but I'm including just four. Okay, to make easier electronic payment in healthcare facility. This is the one of the important way of purpose. Electronic payment in healthcare facility. Protection of PHI, patient health. Okay, patient health information. So, patient health information is protected through this medical coding because it's a coding format, alphanumeric code. So, if anyone or unauthorized person cannot be read it because it's a medical codes, it's a coding format. So, nobody can read without the permission of healthcare. Clear? And they don't understand the basic things. Okay, because it's a coding. So, only medical coders can read medical codes. And next one, reduce the saving space. Reduce the saving space means, uh, you know, it's saving spaces in the healthcare. Okay, and eliminate the chance of missing documents. It's also help to eliminate the chance of missing documents. Okay, eliminate the chance of missing documents. So these are the purpose. Not only this, but also a lot of purpose are there. Mm? And next is next is types of codes. Okay, types of codes and medical coding. Already I uploaded this ICD, CPT, HCPCS. These are the three types of codes: International Classification of Diseases, Current Procedure, Terminology, Healthcare Common Procedural Coding System. So these are the basic codes in medical coding. Okay. Let us discuss ICD. ICD are classified in, we have ICD 9th clinical modification and 10th clinical modification. Now we are using ICD 10 CM, okay, updated version. ICD 9 is old and ICD 10 is more updated. So we are using in 2025 ICD 10 CM. Okay. Okay, let us know the basic idea of what is ICD. ICD means it's an international classification of diseases. It contains diseases codes. Okay, and it is developed by World Health Organization in 1979. Okay, 1979. So in your interview, is the most important point. Write it down. Developed by WHO, World Health Organization in 1979. Okay, to monitor birth rate, death rate, and disease rate. Okay, birth rate, death rate, and disease rate. So to monitor these rates, It is very helpful for the World Health Organization. And ICD-10 CM. What is the difference between ICD-9 and ICD-10? ICD-9 is the old version and ICD-10 is more updated than 9. Okay, it's an updated version. The full form is International Classification of Diseases 10th Revision Clinical Modification. Okay, so this is the full form of ICD-10 CM, and it is published and maintained by WHO, World Health Organization. Okay, and the date October 1st, 2050. Okay, so October 1st, 2050 to 2025, current year, we are using ICD-10 CM. Okay, ICD-10 CM. Here is the comparison between ICD-9 and ICD-10. Okay, it consists ICD-9 consists of 3 to 5 characters for code. Okay, our code consists 3 to 5 characters, but in ICD-10, 3 to 7 characters. This is the major change in ICD-9 and ICD-10. Okay, and first digit is a numeric alphabet E or V. Oh, ICD-9, they have used E or V as a first character. But here we use A to Z characters. A to Z, all the alphabets, right? And ICD-9 is about 13K codes, 30,000 codes. But here 68,000 of codes. So new codes, more codes are updated in ICD-10, and also the structure is updated. It contains 3 to 7 characters and A to Z alphabets are put in the first digit. But old version E or V they have used. And next is detail is lacking. Details are precise. Okay. Here is the example. In old codes 496, 414. So, normal numbers, and V55.3. This type of codes are there. But now R52, K11.3, J03.90 are using nowadays. Okay. So this is the major difference between ICD-9 and ICD-10. You guys just note it down, because in your interview, this is very helpful. Okay, this is very important. So note it down. Okay. And next is purpose of ICD coding. We can use ICD codes to report what purposes? Diagnosis. Already we discussed diagnosis purposes, injuries. Okay, reporting injuries, poisons, signs and symptoms, external causes, supplementary information or additional information. So these are the basic things included in ICD codes. Okay. And the textbook is very big textbook. It contains mainly 2 sections. Alphabetic index are there and tabular list are there. Okay, in alphabet index there are 3 sections: section 1, section 2 and section 3. Section 1 contain index to disease and injuries. Normal disease are there, injuries are there. Okay, this is our basic thing. And move on to section 2. It contains table of neoplasm. What is neoplasm? It means cancer. Okay, table of cancer related things, table of drugs and chemicals also. So these are seen in the section 2. And move on to section 3. ICD-10 CM to external cause of injuries are in section 3. External cause of injuries means, burns or any type of injuries, extra causing injuries are included in the section 3 part. Clear? So this is our alphabetic index. If in your documentation the physician documents any disease, just read the disease and take the code in the alphabetic index first of all. For example, fever. They have mentioned fever. You have to take the code in the alphabetic index. Check the alphabet F and move on to FE, FEV, FEEVER, fever. Okay, then take the appropriate code of fever. That's not entered. The code fever, you got a code from the alphabetic index, you can check it within the tabular list. Okay. Only after that you have to code. Okay. So first of all, you have to take the code from the alphabetic index and check the code in the tabular list, then report the code. Clear? So this is the procedure done in the ICD book. Here is a question also fever. Okay. So try to take the code fever. You have to take F in your textbook. Okay. FEVER. Okay. Take fever code and check it in the tabular list. Ch- Uh, why do you want to check the in tabular list? Because it's a confirmation. Confirm the code, the right code or not in the tabular list. And some homeworks are, I am giving some homeworks: pneumonia, headache, hypertension, tonsillitis, jaundice, gastritis, hemorrhage, hepatitis, sepsis, nausea, pain, lipoma, etc. Hmm? So, also there 23. Okay, obesity, hematuria, tachycardia, myofibrosis, rubella, bedridden, calcinosin, fatigue, rabies, HIV, keratitis. So these are homework for you guys. So try to answer these questions. I will upload the answers in the next video. Okay. So you guys take the codes, appropriate codes. Clear? And one more question. It is related to two term. Typhoid fever. Typhoid fever means you have to take the code fever first of all. Under the fever, you can see a typhoid. Okay, then take the code. So this is a two-term question. Hmm? Stomach ulcer, heart failure. How to take stomach ulcer code? Just to take ulcer, not stomach. Okay, you have to take ulcer. This is a primary disease. So take the diagnosis ulcer, and under the ulcer you have seen stomach, then take the code. And also heart failure. Heart failure means you have to take failure. Okay. Renal stone, also take renal or stone, both. You can take both way, but easiest way is take the diagnosis and search the location. Clear? A nasal polyp, abscess of liver. Abscess of liver means abscess. Take the code of abscess. And hepatic failure, take the code of failure, then you can see the hepatic failure. uh, Cushing syndrome, take syndrome, then you have to see the Cushing syndrome. And senile keratosis, take the code of keratosis and you can see the senile keratosis under the keratosis. So take this codes also. This is some homework for you. Okay, 8-1. And next is three-term questions. Three-term questions means, a condition, urinary tract infection, UTI. Another name was UTI. So here you have to take in the infection. First of all, you have to take infection. You can see urinary and you can see the tract infection, urinary tract infection. This is the three-term question. Mental health evaluation, high risk infant. Okay, and four-term questions: thoracic descending aortic rupture. So search rupture or descending or aortic thoracic, whatever. Take the code. Okay. And next is code category S20. S20 category code, a 101 subcategory code. Here is the code S20.101. So this code can be classified into two sections. S20 is called category code and 101 is a subcategory code. Okay, in your CPC examination, they have asking this type of questions. There is a full stop in the center. So before the full stop, there is a three character. This is called category code, and after the full stop, three characters. This is called subcategory code. Okay, note it down. Next is C and C also. C means the C instruction in the alphabetic index indicate that another term should be referenced. Okay, so C, you can see in your textbook there is a C also that type of description. So C instruction in the alphabetic index indicate that another term should be referenced. Okay, so for example, cholecystolithiasis, C calculus, gallbladder. They have mentioned in your textbook. Okay, so you guys take cholecystolithiasis, take the core. You have to see C calculus and also gallbladder. Okay, okay, so try to take this code. Homework, gastric ulcer, blood loss, recurrent fever. And let us see also. C also means instruction to review another main term if all needed information is not located under the first main term. So, mm, instruction to review another main. For example, capillary angioma. See also hemangioma. So both are same. Okay. You can take the way of code in this C also. And hemangioma and capillary angioma. Clear? Okay. Okay. Just a second, guys. I'm drinking some water. Wait, karo. Okay, and here are some homework for you. Arteriosclerosis, stenosis of fallopian tube, skin boil, acute kidney failure with tubular necrosis. Okay, so mhm. And next is incomplete code, tick mark. Tick mark means incomplete code. Tick mark in alphabetic index indicate that the code is incomplete. To make it complete, refer the tabular list. Okay, so here one question: cholecystioma of Attic right ear. Check this code. You can see a tick mark in this type of codes because it is a incomplete. So you have to make it complete. You have to refer the tabular list. Take what the code, so take the appropriate code in the tabular list, and you have to see some some guidelines, so you have to complete the reference. Okay. Also a homework is there. Next is essential modifier. Subterms that are listed below the main term in the alphabetic order and are identified. Alzheimer's disease. Both codes are reported and remove bracket. Okay, Alzheimer's disease means both codes are reported and remove the brackets. This type of codes: congenital syphilitic hepatitis, amyloid heart disease, two boys disease. So, subterms listed below the main term in alphabetic order and are identified. What is the main term? Identify the main term and code it. Non-essential modifier means non-essential modifiers are subterms that follow the main term and are closed in the parenthesis. Okay. Uh, you know, parenthesis means some brackets. Okay. You guys try to answer this: diabetes mellitus, infantile anemia, hereditary brain ataxia. Okay. Next is combination code is a single. What is combination code? It's a single code used to classify, combine. Okay, two codes combined together. It is called combination codes. So a diagnosis with an associated secondary process manifestation, a diagnosis with an associated complication. Okay, nausea with omitting is an example and one question to answer. Nausea with vomiting means the two conditions are almost the same. Okay, two diagnoses associated with the secondary process. Okay, so this type of codes are called now combination codes. So in this case, you have to use single code. Nausea with vomiting, you have to use only single code. Hmm? Diabetes mellitus with chronic kidney disease, gastric ulcer with bleeding, anemia due to chemotherapy. Okay, multiple codes means you have to code multiple. Okay, multiple coding is the use of more than one code for the identification of certain element of a complex diagnostic statement. You have to use more than one codes, or you have to report more than one code. So in this case there is a question: rhinitis with this dyspnea. So you have to code both the codes. Clear? Next is very important section, seventh character, A, D, and S. Everyone know about that. In our medical coding ICT section, we want 3 to 7 characters. So if the seventh character is not visible, you have to add. You have to complete the code by using A, D, and S. Okay, A is for patient first admission. D is for follower list or follow up or checkup. Okay, and S for new condition formed by the existing condition. Okay, so this is the seventh character. Okay, clear. A, D, and S. How to use this character? A is patient first admission or initial encounter. A seventh character A is used for encounter where the patient is receiving active treatment for the condition. Okay, patient is receiving a treatment for his condition. You have to use seventh character A. Okay, example: surgical treatment, emergency department, treatment by a new physician. Whatever the condition, you have to use the seventh character as A character. And D is for subsequent encounter. Subsequent encounter means follow up or follow up care. And after the patient has received treatment of the injury and he is receiving routine care, or he is coming to a follow-up care, you have to use a subsequent encounter. In your question, they have mentioned the patient is discharged from your hospital, but he is a routine checkup. So this type of cases you have to use seventh character as a D. Seventh character. Seventh character is not visible cases. Okay, without seventh character, you want to complete the sentence by using this. And another case, the seventh character is there, already existed in the code. You nothing want to do. Clear? So D is subsequent encounter. It is for healing purposes or routine care, routine follow up, checkup. Okay. Example of active treatments are cast change or removal, removal of external or internal fixation device, medication adjustment, other aftercare and follow-up visit following injury treatment. And S for sequela or complication or late effect. Also important. repeated in CPC. Late effect. What do you mean by sequela? Sequela is a late effect on injury or complication. Hmm? For example, scar formation after burn. This type of condition is called sequela. So the guideline, if an encounter is not mentioned as initial, subsequent or sequela, consider it as an initial encounter. In your documentation, they have not mentioned any initial, subsequent, sequela. You have to code the seventh character as A. Okay, clear? This is some questions I'm giving. Um, Contusion of liver, initial encounter. So in this case, you have to code contusion of liver, initial encounter they have mentioned. So seventh character as A. A is the initial encounter. Clear? And there is a homework for you. I will explain the homework. Okay. Patient visited first time for a treatment of open wound, ankle injury, and left side. First time the patient is visited for first time treatment. So also a initial encounter. Okay. The patient is visited for first time. First time for treatment of open wound, ankle injury, and left side. So first time the patient visited, you have to code initial encounter. Okay. For routine care only, you have to code the D. Hmm? So this is the questions I'm giving, and also one thing, placeholder. Placeholder means the letter X is used as a placeholder. What is placeholder? In ICD 10CM, X is used as a placeholder. X is to fill field to be able to append 7 character. When the code is less than 6 character in length, you have to use additional X to complete the 7 character. Only you have to use ADS at the end of the code. I mean, at the end of the code, you can use ADS. Otherwise, at the mid course, you have to use X as a placeholder character. Clear? Here is the questions. So try to solve these questions, dear. A sprain of jaw, right side, subsequent encounter, and also some homeworks. First visit of the treatment of crushed chest. Patient visited first time for foreign body in cornea of left eye. Patient visited second time for foreign body in nose. First time visit for the crushed chest of the right ankle, and first visit for nasal bone fracture. So these are some homeworks. So you guys try to solve all the homeworks. I will upload the answers in the next video. Okay. Stay tuned for more videos. Bye bye. Thanks for watching.